Preconception care involves a wide range of interventions that aim to improve the health of potential parents before a pregnancy. Now, preconception care can apply to a really broad range of the population, basically anyone who might become a parent in the future. Because it's such a broad group with such a broad range of interventions, it's important to have clinical practice guidelines to help healthcare workers deliver high-quality care. Research shows that there is a lack of consensus on clinical practice guidelines, both within Australia and around the world. So our team of researchers from Australia, the United Kingdom and the USA got together and performed a systematic review, which is where we search and appraise all the available evidence on clinical practice guidelines for preconception care. We searched over academic databases, clinical guideline registers, relevant professional organisations, and even a simple online search to find over 6,300 documents. As a team, we went through these and found only 11 clinical practice guidelines that focused on preconception care. 5 of these were from America, 2 from Canada, 2 from Australia, 1 from India, and 1 from an international collaboration, FIGO, the International Federation of Obstetricians and Gynecologists. We use the Agree To tool, which is a validated tool that assesses guideline quality to appraise these guidelines. We also assessed the levels of evidence that underpin these guidelines and paid particular attention to which guidelines included priority populations and men in their advice. Using all of these tools, we found that only 1 clinical practice guideline, the Canadian Guideline for Planning in Pregnancy for People with HIV, was of high quality, and the other 10 were of moderate quality. When it comes to looking at the content of the guidelines, the level of recommendations ranged from 2 recommendations within one guideline to 113 recommendations in another guideline. Of the guidelines, 6 included advice for men and only 3 included advice for priority populations. The level of evidence within the guidelines ranged from 1A for evidence on folic acid supplementation and reducing the risk of HIV transmission to level 3. Preconception care is an incredibly important area of preventive health that needs high quality clinical practice guidelines to support its delivery. Our systematic review has shown us that currently existing clinical practice guidelines can be strengthened with an increase in their clinical content areas and an increase focused on priority populations and men in their advice. Now, these are just some of the priorities of the Preconception Health Network.